wow, people who miss this conference, they are losing a lot, you see. They should attend conferences like this.
Given the title of the talk, a Chinese expression, they're normally called chengyu, which are sort of idiomatic expressions. And it's one of the wonderful things about Chinese language is that they have an awful lot of idioms. In English, we've got a fair few, but if you ask somebody how many idioms do you know, normally they'll get about 10 or something. But if Chinese people have, I've got a little book at home, it's got 5,000 idioms in it. And I sometimes test people who are Chinese, usually my wife, whether she knows them, and I'm always quite surprised that it's quite hard to find an idiom she doesn't know. So this one is 中人食柴火焰高. 中人 is us lot, it's the masses, the people. 食柴 is picking up the sticks to make a bonfire. 火焰 is a bonfire, so, and gao is higher. So it's relatively easy to understand the meaning for an idiom. A lot of the idioms are linked to history and Chinese particular stories. But this one, it just means that we need to work together in order to sort of make ourselves known and get our point of view across. So that's kind of the theme that I would like you to sort of run through the whole lecture, that it's what we need to do is work together as a professional group, but also make connections and work together with people who are not maybe pure acupuncturists but are interested in acupuncture, whether they are scientists or whether they are scholars of Chinese language and anthropology. And the second part will be the anthropology element is sort of the second theme that I hope will come out as I talk through the importance of that. Okay, so to begin with, I would like to think, that we've got a collective, we work together, but then we have a sort of collective consciousness of ourselves as acupuncturists. And interestingly, Nick was just saying to me, he's trying to learn to spot acupuncturists in the street. And I suggested that next year he hangs around at the train station and watches people come off. I mean, most people probably do that when you get off and you're looking for the shuttle bus and you're thinking, who else is an acupuncturist here? So you can sort of say, do you know where the shuttle bus is? But we've got a collective image of ourselves, of what kind of people we are, and we've also got a collective professional identity, that other people see us in a certain way. And that's something that became quite obvious to me when I started working at London South Bank University, because our course is based in a health faculty. And each discipline, allied health has got quite a number of different disciplines. So physiotherapists have a concept of themselves. Occupational therapists have another concept, and they have mutual views of each other. Not always good, but they do. They have this kind of, they do that, and they think like that because they're a physio. They're so mechanical. And then the other physio, they think like that because they're occupational therapists. They're so off in the air or whatever. So the idea is that I'd like us to think about what image we project, and what are the things about what we say and do that projects that image. And to link it back to the idea of everyone working together, that image is generated by everybody. It's not simply the BACC's press group in an office projecting an image of acupuncturists. It's everyone who works as an acupuncturist. When they're in their clinics, even when they're talking to people at a dinner party and you say, I'm an acupuncturist, and somebody starts steaming
and they'll say, I'm a scientist. And then they'll go off on you about certain things. It's how you respond. It's how we all respond. Collectively makes an image. And you could call it a public image, if you like, or public opinion. And then if you jump over into the idea of sort of public international relations, Noam Chomsky, I think, said public opinion is the world's second superpower after America. It's the one thing that can stop things from happening and make things happen. So when we're thinking of ourselves as a profession, we want to develop that profession, then we have to think about the image we are projecting to people. Okay, so that's it. There's another attachment to that. So what I want to get across is it's not just people in colleges or who've got whatever position. We might have things like the butterfly effect, that you say something or do something in your clinic, you get somebody better. And that person happens to be related to someone who says someone else. And before you know it, the Minister of Health or whatever is changing their opinion. Because for whatever people say about, I look at research, and they're perfectly, or they maybe, I would say, delude themselves that they're perfectly objective. They can't be. It's based on what experiences you've had. So that's sort of the pressure that pushes acupuncture forward, really. That's part of the reason why we're here today, and what drew you in and what drew me in, etc., is word of mouth. I don't believe research has really got us here where we are today. The biggest pressure to make acupuncture move forward in this country and a lot of other Western countries is people just being open-minded enough and interested enough to give it a whirl. No research evidence. I mean, when I started training in the 90s, there's virtually no research, I would say, around. Very, very small trials. You can't find statistical evidence from a group of 15 people, by and large, unless by some miracle everybody gets better in that group of 8 and no one gets better in a group of 7, which you wouldn't expect. So we've got this public consciousness, we've got potential for everyone to be, not just potential, everyone is involved in that, not just people who are lecturers and things like that. So as a kind of a hook to get my ideas across, because what I obviously want to say is, how do we develop? How do we move forward? What is our dream, if you like, where we want to go? I'm going to use sort of like a court case, because I'm not overly paranoid, but I would say that we are, by certain groups of wider public, professional bodies, let's call them science, not just scientists, but that they lay charges against us. So I want to think about what are the charges that they lay against us, and I'm going to give you sort of my case for the defence, as it were. Okay? So I keep going here because I'm expecting to move the slides on, but there are no slides. So I'll pretend, and maybe you can wish for. But I would say charges, you can imagine that. The first thing to do is to narrow down that wider public opinion view, those people who are interested or involved in acupuncture. I've got a little diagram, and it's really just got 4 groups. I've simplified it. You've got healthcare professionals, those are the doctors, whoever, the British Medical Acupuncture Society, the physios, some of whom I know are here. You've got scientists, and by this, in particular, I'm talking about people who are trying to find the biomedical mechanisms for acupuncture and how it might work. You've got anthropologists and scholars of Chinese language, history and medicine. Okay? And you've got us, and we kind of sit somewhere in the middle, and you might put us in a dialectic against the people who are interested in acupuncture, but from a Western medical background. So the common charge that's laid against us is pseudoscience. And it's a kind of interesting thing. It's because people decide who's a scientist. I don't know, but some of you probably have science degrees before you became acupuncturists. I've got a science degree from my deep and dark past. And I know a number of other people who are course directors or whatever also came from a science background. But the idea is that pseudoscience and what we do in universities is kind of fake and it's a phony. Now, going back to the idea that we have scientists studying acupuncture. Now I feel a bit like Dave Allen, give my age away. Have a little seat. Yeah, that's right. That would be a great image for the Viaxi. So we've got the scientists, we've got people who are really looking at, neurology, trying to understand the mechanisms, looking at the brain, neuroscience, whatever. And when you look at the research, if you have the chance to look at research, you might find that Harvard Medical School does this and produces quite a lot. And, I would see that as an element that I would want my students to be moving towards understanding and engaging. And I would see that as an element that I want to engage in myself. But it's quite unusual for someone to say, oh, neuroscience, that's a soft option. I wouldn't do that at university. And in the same way, as sort of the opposite side, but also people I think we really need to think about working with, you have people who are studying Chinese medical anthropology and looking at how Chinese medicine has developed through the years. And again, no one, if coming from Oxford University or the Needham Institute, nobody would conceive as being a soft option. I mean, our students learn Chinese, but nobody, in another context, you would never say learning Chinese was easy. Quite the opposite most of the time. So we've got this idea, what is it that really bugs people about our degree? What is it? And I think the central issue is that within that, there's a view that we believe that traditional theory is of some use. You can study in the pure abstract in a top university like Oxford, and you can study the biomedical point of view as long as you're doing it in a sort of positivist way, trying to unwrap the phenomenon. But the worst thing is to say, no, that information that's collected in, I think, roughly 10,000 books from the Imperial Library before Western influence really got there, of all of that information, none of that is useful. You shouldn't put that in there as a degree. So that's one issue. And the other thing is, aligned to that, we've got what comes out of the research. And I'm thinking particularly, this is where you would need the graphs, about the research that's done in Germany. So hopefully you're going to be relatively familiar with what happens in these larger scale trials that have been done in Germany. You have 1,000 plus people being treated for back pain. And the results showing, basically, you have a 50% or so people getting better for having acupuncture, and about 27, 26% with their normal care. That's having physiotherapy, taking medication, and being Germany, going to the spas and things like that. So that's the first idea that comes out of the research, is you have this, well, it works in some senses. But then the problem is they set up a sham acupuncture and a verum, a real acupuncture, so using shallow needles, off-point needling. And what they found is quite similar between... Just in time. You'll get to see those glorious graphs in a minute. So you see a similarity between what the so-called real acupuncture does and the sham acupuncture. But generally speaking, there is a higher amount, you get more people better or better outcomes for the real acupuncture. But within that gap, people have used it to essentially say, look, the traditional theory is no good because it doesn't matter what you do with the needles. You can put them anywhere. It's just, in the wider sense, it's just a placebo effect. It doesn't matter. So they're quite, in some ways I think the trials have been problematic for those who are almost consigned themselves to be against acupuncture. So the firewood one, this one. Can you see? Firewood, bottom left. Yeah. That one. That's mine, isn't it? Yes. That's fine. Double click. Oh. Yeah. Okay, so come down to slide 6 if you can. Yeah. Okay. So I'll have to sort of cue you as well, won't I, to move it on. Okay. So that's not quite randomly selected. I did choose the ones that look best. But also, I also wanted to just add in, this is dysmenorrhea and this is rhinitis, because obviously we go down a certain track of, it's all about pain. But then you've got osteoarthritis at the end. So the light blue, that's the acupuncture, and that's the usual care. So, Gavin, could you knock it on one? It's all right.
And what's the percentage there?
It's just a percentage of the overall outcome. Yeah. But you can look it up. I think you can get this research, download it for free from Mike Cummings, acupuncture in medicine. It's just a general idea that I want to get across. And this is low back pain. So you have the usual care, the sham, and the Virum acupuncture. So you can see it's very, very close. Very, very close. So people have used that to sort of focus in on the fact that the traditional ideas are of no use. Okay? And that's the fundamental thing. Kind of matching with the disgust or the dislike of acupuncture within a university is you shouldn't really believe in that sort of information. Can you knock it on? So a typical, this quote, as it were, data from the German research programs provide clear evidence that acupuncture is an effective tool in the treatment of chronic pain, which is a good thing. That's obviously what your patients want to know. However, the correct selection of points seems to play only a limited role in the effectiveness. Okay? And this is from the Cochrane Review, which they say is gold standard. The effects of true acupuncture relative to sham do not meet our pre-specified thresholds for clinical relevance. So what they're saying is that small gap isn't relevant clinically. They pre-specified it before, said that should be the gap. But I put a ... because we're going to come back to it in the defence. So you can knock it on. The other thing, of course, is that they say chi does not exist. And that is sort of used 5 minutes? Oh, my goodness. Right. Chi does not exist. We better get on to the defence then. You move along. That's the key point. How we relate to this traditional knowledge of fundamental importance. Yeah? The case, I've got a sort of 5 lines of defence. One is a very general point. Then it's called the tale of the inner pass. Sham, sham, virum, virum, and equal measures, chi does not exist. Gavin, once more. So generally speaking, as I say, there's about 10,000 books, all of that knowledge written down. We don't know what it says, or many of us don't know what it says, because it hasn't been translated, it hasn't been properly fully assessed. So from my point of view, I think it's a little bit rash to say that none of that is useful, because you've never read it. But on the same time, you think all of this knowledge has come from roughly 1/4 of the world's population for 2,500 years, and it would be extremely unusual if someone hadn't written down something that was a bit dodgy. Yeah? Why should all of that be true? So fundamentally, I think saying it's all correct or all wrong is a bad position. So clearly, for me, some people in the biomedical view say that it's all wrong and it's not worthwhile. That's a general point. Moving on. Tale of the Inner Path. Okay, thank you. Got a few more minutes. Okay. Inner Path, those of you know, Nei Guan is pericardium 6. Now, pericardium 6 is one of the most researched points in acupuncture. And I'm sure a lot of the reasons why it has been researched is convenience, or it's just luck in many ways, that a surgeon or whatever wanted to look into a way to help people get over post-operative nausea. Because, those of you who've been aware of the sort of new stricter guidelines on what we can say as far as advertising, you should be aware that the one thing, the most thing that almost can't take away from us is treatment of post-operative nausea. Okay? Now, what I'm going to say is pericardium 6, or Nei Guan, this point has been used for nausea for, let's say, 1,000 years, and written about and used. But it's what they're saying, according to the evidence, it's only after an operation. But of course, we know an operation is a modern phenomenon. So technically, you're not allowed to say it's just for other kind of nausea, if it's when women are pregnant or you just feel sick. Because there's no evidence for that. Okay? But for that, you have to believe that the point was used but didn't really work for 1,000 years or so. And it was only by an extraordinary stroke of luck, when people invented general anesthetics and were able to do operations, that this point started working. And it just happened to be the point that people had written about in the book, which I think I wouldn't want to bet on that being the case. It doesn't seem very likely to me. Okay, moving on. The other thing is, with Nei Guan, what you'd have to say, because we got this one bit of evidence, that it is the only point out of the 365 classical points, plus all the extra meridian points, it's the only point that has any effect on the body, internally. Now, why should that be? That, again, to me, seems quite unlikely, that a point here is the only point that does anything. Why there? Okay? Oh, sorry, go back. This function only relates, and again, that's what I said, post-op, and not to an illness it was originally for. This is the only place. So that's really, that'll do. So, sorry, yes, you can move on. So for me, there's this kind of real conundrum for someone who wants to dismiss all of the knowledge that was in the books. Why should that be the only point that's of value, and all the rest nonsense or pseudoscience, whatever you call it? Okay. When you look at the German trials, quite a lot has been written. I don't want to go over it again, about sham. It's not necessarily a real sham. It certainly has a biomedical effect, sticking a needle in somebody. What I'd like to concentrate on is the Virum acupuncture. How real is the Virum? But I'd just like to point out, for those of you who might not know, somebody did a review looking at, for a variety of conditions, comparing sham acupuncture to Virum acupuncture. And in no case did they find that the sham was better than the Virum. Yes? It's always the real acupuncture that's better than the sham. Okay? When we come to real acupuncture or otherwise, one thing we don't know, and those people who teach or whatever, so when you ask people to locate points, your students will generally put them in different places. We know they follow the instructions, but it's just measuring is kind of a natural measurement rather than a strict decimal centimetre or whatever. So people move them around. Of all the people in Germany, we don't know how consistent they were at finding the right place. And the second thing is, we also don't know how accurate we have to be to hit the right point. We don't know what leeway we've got. So it could be, if you're right on the point, you get 1,000 points, but if you're 2 millimetres off it, it drops down to 100. If you're 5 millimetres off it, it's 50. Yes? So that element of Virum acupuncture, we don't know. So we don't know how real, how perfect that was, okay, in the German trials. But we actually don't know generally what a point looks like and how its effect changes as we go away from it. But what I can tell you is when you look in a Chinese book, a traditional book, where the point is a very vague description. It's not as precise as we get the impression from reading a more modern English book. When I was in Japan, my teacher, as far as he was concerned, points moved, and it was the skill of an acupuncturist to be able to palpate and find the point. And this, for me, is one of the key things about acupuncture, that it's a skill, and you need to learn it. And we don't know exactly how to do that. But if you take other walks of life, for example, playing football or music, I can kick a football, and if Sir Alex Ferguson asked me to play for Man U, £55,000 a week, I would do it. But there are very, very good reasons why he doesn't even phone. You know, they're very good reasons. And we don't know who we are, whether you're similar, whether you're an acupuncturist of the Wayne Rooney class or playing in the park. We don't know. And how to train that. It's an individual thing. And it's across many walks of life, singing, etc. It does, you know, a few music lessons doesn't make you Pavarotti. Okay? So it's a skill. We don't know how real it was. Okay? Yeah. Equal measures. It's just something I wanted to point out for you. That earlier quote about the acupuncture not meeting the predefined difference, clinical relevance between sham and real acupuncture. What comes after that is how a few, if any, commonly used treatments for arthritis meet those thresholds. So what they're telling you, if you give a genuine placebo to people for their knee pain or whatever, and compare that to non-steroidal anti-inflammatory drugs, there's still a very small gap. And this is a sort of review from 2007. In conclusion, common pharmacological interventions give limited, if any, short-term pain relief for osteoarthritis of the knee. These findings suggest that it is time to reconsider the place of these drug therapies in osteoarthritis knee management. Yeah? Okay. Qi does not exist. Normally what I would say to people is you have to look at concepts that we have. First, the ego, for example, which comes psychoanalysis. You can't find the ego, you can't test for the ego, you can't prove that it exists or doesn't exist. Yet people are very happy for that concept to be used in discussion of what it's like to be a person. We don't have a problem with it. But when we take that sort of information and take the Chinese versions, people get, oh, that doesn't exist. In some ways, qi must exist. If you understand Chinese, you would know that the character qi is very common. So you say something like sheng qi, anger, expanding, growing qi, like a cartoon character goes up, red face, steam out the ears. That is getting angry, sheng qi. So you can't deny a concept that many people has meaning for them in communication. Okay, next one. The way forward. And is this really theory? So what I want to suggest is this knowledge that we have from Chinese medicine, the tradition, is very diverse. It always has been from the beginning till now. And it is not a theory in the sense of a scientific theory that we can use to generate hypotheses to prove it or otherwise. There will never be a research clinical trial that disproves or proves Chinese medicine theory. You'll only be able to isolate certain aspects of it and try and test it. And that's, in effect, what has happened with P6. It's an isolated case, and it's been shown to work. And we would need to work to identify similar cases and move that forward. Okay. So what we've felt at the Confucius Institute is that we would like to enable people to be more involved in research, etc., and to debate these issues. So what we'd like to do is set up a collaboration, and basically it will be sort of like a reading group. We'll enable people to sort of access research that they can't access normally. We have bilingual doctors, so if you're doing a project, we'll help you get the information and help you translate it if it seems worthwhile. And basically, we would like to invite any of you to get in touch, and we'll have it maybe once every 6 weeks or so, a little bit like the regional groups. You come along, we'll provide space, we'll provide some support logistically for getting information, and we'll sort of take it from there. Okay? Well, sorry that we had no earlier presentation, and thank you.